Good morning, Tewksbury. It is 11:03 a.m. on Friday, January 14th, 2022, and I'd like to call this emergency meeting of the Tewksbury Board of Health to order. One thing on our agenda today, and that's just to review COVID case counts. And I just want to set the record straight because I understand we may have a whole bunch of people watching us live. Somehow there was misinformation that were out there in public that today we are going to be considering either a vaccine passport or a mask mandate, both of which are furthest from the truth. So we have nothing like that even on our plate to consider for today. So with that, I'm going to share my desktop. And okay. So in the numbers that we have from the state's website that they post every Thursday around 5 p.m., I've been charting the average daily rate of new COVID cases per 100,000. It's a 2-week average. And I just wanted to show you that last week we were down here being the week right after Christmas. This week we're almost double the number, and that's representing probably the influx of New Year's Eve or New Year's events. But I also wanted to share with you the numbers because the trend is sort of lagging a week because it's a 2-week average. But when we look at the actual weekly numbers, let's put my email. The numbers are much better because the weekly numbers for Tewksbury are actually showing a decrease this week versus last week. So while 1 week does not make a trend, it's definitely going down in the correct direction. So in hang on one sec. I forgot which account it was sent to me. Yeah, let's see if it's updated on the website. Okay, perfect. Okay, so let me share numbers. So what is everyone able to see a COVID-19 everything you need to know screen?
No, it's a blank gray screen. Yeah.
Okay, let me try this. Let me share my screen. Show my meeting window. Nope. Share content. Oh, there we go. Share screen. Okay. So on the town's website, for openness, when you click on the COVID Everything You Need to Know, the numbers were just updated. And I wanted to draw your attention to when Shannon pulls the numbers from the Maven State database, she does it on Friday morning. So this is everything, Shannon, from the prior Saturday through at that point in time when you're pulling the numbers, correct?
Correct.
Okay. So it's showing that the week 28 new cases. The week after New Year's, it was 499 new cases. And this week it's 394 cases. So we're down 105 cases from the prior week. And there is not a direct correlation between the numbers we pull from Maven and what the state has, because the state, we're not quite sure yet what the state uses to factor in all the numbers they include for Tewksbury. But when the department looks at Tewksbury residents, and Shannon, correct me if I'm wrong, this does, you exclude state hospital patients as if they're technically not residents of town. So this is residents of town as opposed to people that stay in town.
Right.
Okay. So again, while 1 week does not make a trend, it is encouraging to see the numbers going down. And this correlates to what I'm seeing at my school. It's also more importantly correlating to what you've been seeing in the news about testing wastewater outflow at Deer Island and other places where it's been showing that the spike in the amount of COVID they've been detecting has been going down. And talking, remember Charlie Rue before the meeting started, he also had some the same information from, so I think you said it was the MWRA. So that again is showing that through wastewater sampling, the amount of COVID is going down. So I'm hoping that we're past the peak. And I know personally, and I'll pull my other board members that are on the call, I think that we just have asked residents to continue to follow what the public health advisory that they issued last Friday asked for, just to mask up if you're able to, go back to practicing the things that we had all been doing successfully last year to bring the curve down of trying to social distance, keep 6 feet away from people, frequent hand washing, or use hand sanitizer if you have it, and then rethink when you're going out in public, especially if you're health concerns, or look at going to stores at times when there's peak traffic, so you're not as concerned about going to a store where people may have decided not to wear masks and are in there. So we're all doing our part, and I think it's showing that the numbers, at least in town, for 1 week have gone down, and hopefully that downward trend will continue. So with that, I will leave it up to Ms. Cirulis and Mr. Rue if you have any additional comments or insight you'd like to offer.
Mr. Chairman,
Yes.
just a quick clarification on what I had mentioned earlier is that the information I had as of Tuesday was from Dr. Paul Sachs from the Mass Office, excuse me, of Contagious Diseases at Beth Israel. He reported a 41% drop in COVID in the wastewater samples from MWRA. And again, that's good news, but let's not be overly happy about that. Let's keep the ball rolling here with what we've been doing on this stuff. So, so if anybody wants to check out the source, that's where I got it from. Thank you.
And just to clarify on that too for residents, our town sewer discharge is not treated by MWRA. So while that's a 41% decrease, it also is not directly reflective on our town because our town sewage does not go through there. And Mr. Rulis, any comments or insight to add?
Just that I, as happy as I am to see the numbers have dropped slightly, I have to reiterate that people should continue doing what we've been doing for the last few years and keep wearing those masks when they go out in public, because they've dropped slightly, but I would hate to see them all of a sudden start to go up again, because it's almost a false sense of, oh, it's over, because I don't really think it's over yet. Especially with the kids. It seems like the numbers are highest with the younger folks right now. So we have to keep an eye on that as well. Those are my thoughts on that. I am in the city of Lowell, where I am most of the time right now. I'm not seeing the numbers drop. They're going up. So it's a little unnerving. So hopefully we can keep things at bay in Tewksbury.
Well, thank you for that. And Ashley, any insight from you as town nurse?
Sure. No, I agree with what everyone's saying. Again, just keep advising people to wear masks where appropriate. Just would like to reiterate something I touched base on last week, and that is just if you're able, if you're having any symptoms, to try to test yourself, and that can be an at-home, rapid antigen test, or if you can find a PCR. And just when you are feeling sick, to try to stay away from others, and really kind of drive home the point that if we can test ourselves and isolate if we are positive, that will really try to stop the spread here.
And I think everything we've been talking about today is nothing more than common sense. And I know we're all tired of having to hear about COVID and mask up and isolate and quarantine, but I'm hoping, as we all are, that the peak of this surge is hopefully behind us. And yes, it will not go away tomorrow, but I think that hopefully if numbers keep going down, that doesn't mean we should let up on anything that we had in that public health advisory last week, but we really need to keep practicing that for all, because we're in flu season right now and there are colds going around. So it's not just Omicron variant we're concerned about, but it's just trying to ensure everyone stays healthy during these winter months when everyone is inside due to cold weather.
If I could also just add for the public that the numbers that we pulled are only people that receive PCR tests. So those are the only results we get reported through the state system. It's not those rapid antigen tests that people are taking at home. So these numbers only reflect the cases that we know got PCR tests. So there are obviously more people out there that are positive, but doesn't reflect in our numbers.
Okay, thank you for that.
I've heard about a lot of residents struggling to find those at-home tests. So I also question, they may just be skipping testing altogether and hopefully just staying home because they're not feeling well. But we don't know how many of those there are.
Okay, so I'm going to tentatively look at having a follow-up meeting next Friday at 11. Our monthly Board of Health meeting will be next Thursday night starting at 6 p.m. and Director Sullivan will be getting us the Tewksbury numbers in advance of that meeting, so at least we can see if there's a continued downward trend. And at that point, we'll make a decision at that meeting whether we need to hold another meeting on Friday or whether the trend keeps going downwards and we do not need to hold it. But for the public that's out there, our preference has been and continues to be our recommendation that people just go back to practicing the common sense things that we had all gotten used to doing last year and not looking at having any mandates or passports or requirements, but just ask people to do the right and smart thing and keep doing it, and hopefully these numbers will keep going down. And Richard, not to put you in the spot, but as town manager, is there anything that you wanted to get out to residents?
No, I think you covered everything, Ray.
Okay.
We have put the latest numbers up on the website. If anyone has any questions, let us know. We continue to try to have vaccine clinics to make it available to residents. And if there's any questions, just let us know. You did a nice job laying everything out.
Good. And I also want to thank the residents that have been sending in emails to the department, either saying we need to be stricter about things or we don't need to be doing anything. And one resident actually forwarded some useful graphs or charts to us this morning. So we continue to encourage residents to email in your comments to the department. They get distributed to board members, so it does not just go into a inbox somewhere and never be seen by the light of day. So residents, please be aware that board members do get copies of your emails when it pertains to COVID-19. So we encourage you, if you have any comments, to send them in to us. But at this point, we're just hoping to stay the course with our public health advisory recommendations and just everyone keep practicing those and help us get through the winter months. So with that, Mr. Rue, I think it's time for your motion.
Mr. Chairman, I'd like to make a motion that we close today's emergency meeting.
Okay, someone like to second that motion?
I will second the motion.
Okay, motion's been put forth and second to adjourn today's emergency meeting, the Tewksbury Board of Health. We'll take a roll call vote. Mr. Rue,
Aye.
Mr. Rulis,
Aye.
chair votes aye as well, so it carries 3-0. So it is 11:18 a.m. Have a good day, Tewksbury, and you can catch us again on Thursday night starting at 6. So thank you all for attending.
Thanks, everyone.
Bye-bye.
Bye-bye.
Bye.